Hi, I'm Ella and I'm working for NHS Tayside at the moment as an FY1 doctor. I was previously in geriatrics for 4 months and then last Wednesday I switched to Gen Surg. It's definitely been a whirlwind, although I'm in the same hospital. Changing teams has its own challenges. You've got to learn how each member of the team likes to work and how the day kind of runs for that team. So that's definitely been something that I've been working on the last few days. Yeah, I feel like it's important to get to know every member of the team, especially, the team outside the doctors. I always go and say hello to all the nurses and the healthcare assistants and everything like that, just so they know who I am and that I'm about. Um, yeah, I think it is important, jumping on all the ward rounds and seeing how each of the doctors likes to go about their daily business, just to make sure that it's a nice flowing environment and the patients get what they need during the day. The expectations from like coming from medical specialty to surgical specialty are definitely different for an FY1 doctor because you find that the surgeons go off to theatre very early during the day, so they'll come and do their ward round and then they'll head off. So we don't tend to have like regs or consultants about during the day. Obviously they're on the phone, but we are running the ward and we're looking after the patient's medical issues as well as when they come back from surgery, we're doing all the post-surgical reviews and everything like that. So there's definitely a lot more responsibility on the FY's shoulders on a surgical ward. Yeah, my experience previously in geriatrics has given me a really good ground in point for surgical rotation because, the population's getting older. The people I'm seeing on the ward are definitely, of the older kind of cohort. And yeah, it's definitely given me a good grounding point because you get to know how to manage the basics such as like constipation, pain management, and things like that. And it's pretty similar in that kind of sense. Yeah, since we last spoke, all the medical students have started on the ward, so I'm definitely enjoying interacting with them. That's been a really positive thing for me because they are very, very helpful on the ward and they do a lot of my jobs and help me. Um, I think also one of the things I'm enjoying as time goes on is I'm feeling a lot more confident in managing the general kind of situations, the common situations that come up time and time again, and that's been really really nice for me because I'm not having to ask people as much. I just feel happy to go ahead and sort it out. Yeah, so when I going back to geriatrics, when I did a long shift, it was a 12-hour shift, which in itself is quite long, but on the surgical floor it's actually an hour longer, so we're looking at 13-hour shifts. Um it is tiring and it is hard to have a life outside, making sure you're getting your washing and your cleaning done and making sure that you're fueling yourself and being able to do things that you want to do outside of work, that's quite difficult. Um it's also it's a challenge at the end of the night, especially when you want to hand over and give a good handover to the day team or the night team, whatever way around it is. That can be quite difficult because you are tired, but making sure that you pass on the right information is obviously important. Yeah, I think it's really important. The senior colleagues, my senior colleagues, and how they can help juniors on the wards. Even if it's something as simple as like asking if you want a coffee or, do you want any help? Here's my number. I think that's really important because especially like in surgical, I've noticed, we're on our own on the ward. And although they go off to theatre and things like that or clinics, it's just nice to know that they're at the end of the phone if we need anything and how to get in contact with them. That's really a good thing. Yeah, so I'm really looking forward to doing the patient communication course. I think it's going to help me with, the situations that I'll experience on the ward, and it'll give me a good insight onto how I can improve things going forward and making sure that I'm communicating with everyone in the best way possible. Um, I'm also getting excited to get to know, the like we talked about earlier, the staff members on my new ward and learning a lot about different surgical presentations as opposed to the medical ones, and challenging myself to learn a bit more about that and how to manage them going forward.